Hi viewers, welcome back to my YouTube channel. Today I will be talking about the proposed rule by CMS for skilled nursing facility quality reporting program for the fiscal year 2022. The Skilled Nursing Facility Quality Reporting Program or QRP is a pay-for-reporting program. SNFs or skilled nursing facilities that do not meet reporting requirements may be subject to a 2 percentage point reduction in their annual update. CMS is proposing to adopt two new measures and update the specifications for another measure. In addition, CMS is proposing a modification to the public reporting of SNF quality measures as well as seeking comment on two requests for information or RFI. We'll talk about skilled nursing facility or SNF healthcare associated infections or HAI requiring hospitalization measure. CMS is proposing the adoption of a new claims-based measure, SNF HAI, to the SNF quality reporting program beginning with the fiscal year 2023 skilled nursing facility quality reporting program. Typically, healthcare associated infections or HAIs result from inadequate patient management following a medical intervention such as surgery or device implementation or poor adherence to protocol and antibiotic stewardship guidelines. Several provider characteristics are also related to healthcare associated infections, including staffing levels, for example, high turnover, low staff to resident ratios, etc. Facility structure characteristics, for example, national chain membership, high occupancy rates, etc., and adoption or lack thereof infection surveillance and prevention policies. The proposed SNF HAI measure uses Medicare fee-for-service or FFS claims data to estimate the rate of HAIs that are acquired during SNF care and result in hospitalization. Some of the HAIs identified in this measure include sepsis, urinary tract infection, and pneumonia. The goal of the measure is to be able to assess those SNFs that have notably higher rates of healthcare associated infections that are acquired during SNF care and result in hospitalization when compared to their peers and to the national average HAI rate. Implementation of the SNF HAI measure provides information about a facility's adeptness in infection prevention and management and encourages improved quality of care. COVID-19 vaccination coverage among healthcare personnel or HCP measure. CMS is proposing the adoption of the COVID-19 vaccination coverage among healthcare personnel or HCP measure beginning with the fiscal year 2023 SNF quality reporting program. This measure would require SNFs to report on COVID-19 healthcare personnel vaccination in order to assess whether SNFs are taking steps to limit the spread of COVID-19 among their healthcare personnel, reduce the risk of transmission within their facilities, and help sustain the ability of SNFs to continue serving their communities throughout the COVID-19 public health emergency and beyond. Under this proposal, SNFs would report the vaccination data through the Centers for Disease Control and Prevention National Healthcare Safety Network beginning October 1, 2021. Transfer of health or TOH information to the patient post-acute care or PAC quality measure. CMS is proposing to update the denominator for the transfer of health or TOH information to the patient post-acute care quality measure. Currently, the measure denominators for both the transfer of health information to the patient post-acute care and the transfer of health information to the provider post-acute care measures include patients discharged home under the care of an organized home health service organization or hospice. In order to avoid counting the patient in both transfer of health measures, CMS is proposing to remove this location from the definition of the denominator for the transfer of health information patient post-acute care measure. Public reporting of quality measures with fewer than standard numbers of quarters due to COVID-19 public health emergency or PHE exemptions. In March 2020, due to the COVID-19 public health emergency, CMS granted an exception to the SNF quality reporting program reporting requirements from Q1 of 2020 and Q2 of 2020. CMS also stated that it would not publicly report any SNF quality reporting program data that might be greatly impacted by the exceptions from Q1 and Q2 of 2020. This exception affected the standard number of quarters that CMS currently uses to display SNF quality reporting program data. CMS is proposing to update the number of quarters used for public reporting to account for this exception. Now let's talk about requests for information on fast healthcare interoperability resources or FHIR in support of digital quality measurement in quality reporting programs. CMS is working to further the mission to improve the quality of healthcare for beneficiaries through measurement, transparency, and public reporting of data. The SNF Quality Reporting Program and CMS's other quality programs are foundational for contributing to improvements in healthcare, enhancing patient outcomes, and informing consumer choice. CMS believes that advancing their work with the use of the FHIR standard offers a potential for supporting quality improvement and reporting which will improve care for their beneficiaries. CMS is seeking feedback on their future plans to define digital quality measures for the SNF Quality Reporting Program. CMS is also seeking feedback on the potential use of FHIR, which stands for Fast Healthcare Interoperability Resources, for digital quality measures within the SNF Quality Reporting Program, aligning where possible with other quality programs. On this slide, we'll talk about requests for information on closing the health equity gap. Consistent with Executive Order 13985 on advancing racial equity and support for underserved communities through the federal government, CMS is committed to addressing the significant and persistent inequities in health outcomes in the United States through improving data collection to better measure and analyze disparities across programs and policies. CMS is working to make healthcare quality more transparent to consumers and providers, enabling them to make better choices as well as promoting provider accountability around health equity. CMS is seeking feedback in this request for information on ways to attain health equity for all patients through policy solutions. Their ongoing commitment to closing the health equity gap in SNFs has been demonstrated by the adoption of Standardized Patient Assessment Data Elements, or SPADES, which include several social determinants of health, or SDOH, that were finalized in the fiscal year 2020 SNF PPA's final rule for the SNF Quality Reporting Program, which you can also find in 84 Federal Register pages 38805 through 38817. With this request for information, CMS is also seeking comment on the possibility of expanding measure development and the collection of other SPADES that address gaps in health equity in the SNF Quality Reporting Program. I wrap up my presentation with a reference slide. Hope you found this information useful. Before you leave, please consider subscribing to my channel and don't forget to hit like or leave your comments. See you next time. Thank you for watching.